Another one of our annual papers, adult social care fees and charges for 24-25, and I'm handing over, I think, to Colin.
Thank you, Chair. Would you like me to share the paper on the screen?
If you think it's helpful, Colin, but we've had it in good time, so I think you can safely assume people have read and digested if you wish.
Okay, well that's fine. I could just give a summary if that's okay. So this is the annual assurance report for adult social care fees. And this covers the fees for registered services for 24-25, and by registered services I mean things like care at home, care homes, supported living, housing support daycare, and also within the funding are the SDS options 1, 2 and 3. That equates to around £131 million worth of spend, including the option 1. And the cost of the uplift this year was 10.37 million. Now, the uplift for registered services was a Scottish Government. It's a continuation of their policy. This year we went from £10.90 to £12 per hour minimum payment. What we did is we followed the process set out in the Scottish Government in 2 letters. One letter explained the application of the uplift they were looking for, and the second letter followed the availability of funding. So that was set out. In terms of the actual mechanics of the process, we calculated the cost based on what was spent last year, and this was taken to our fees group as a proposal. The fees group then made a recommendation based on what we proposed. This year the key recommendations were only for the £12 uplift and nothing else. It was then taken to the Chief Officer and the Director of Finance for approval. They gave the approval. Where we were looking to go beyond the £12, that wasn't approved, and we were asked to submit business cases. But in terms of the £12 uplift, that's all that was taken forward beyond that stage. It then went to the co-chairs of JOG, and it was then confirmed by the Council Chief Officer that confirmed the transfer of the 10.321 million of Scottish Government funding. That did leave a small gap, a shortfall of 57,000, and that will be reviewed as a pressure through the existing spend. Regarding the £12 payment, what we've done is when we confirmed the fee to the providers, so the providers were expecting the £12, but as part of that process of notification, we've asked for the providers to return a declaration as assurance that they will pass the £12 on to staff. So we've done that, and we've had a good number of returns, but obviously we're following that up. So the report's brought to you today for noting and for assurance.
Thank you very much, Colin. It's nice to see you, and I hope it will be passed on. I'm sure it will be passed on to everyone. Yeah. Okay. I have a particular bee in my bonnet about minimum income, and £12 an hour barely scratches the surface of a minimum income, but it's progress from £10.90. So maybe throw open to any questions or comments. I'm not seeing any hands at all, so I think you're going to escape lightly this afternoon, Colin.
Thank you for that.
Okay, so no, and I think it goes to the clarity of the paper. That's why there's no questions in the moving on. So we've been asked to note the report and accept substantial assurance on the process. Are we content to do so? Lots of thumbs up, and thank you very much indeed, Colin. Short and sweet.
Thank you all for your time.
Thank you very much.
Thanks. Bye now.
Thanks, Colin.
We'll move on to the IPQR. and I'm not 100% sure. James, are you taking this one? I've got your name in front of me.
Yes, I am, Chair. I've just gone to put my camera on. I've come for this item in the absence of Brianna.
Thank you very much indeed, James. We will leave it to you, leave you in your good hands to take us through it.
No problem at all, Chair. Thank you. So what I'll do, Chair, is I won't go through the actual standard covering SBAR, because I think we see that at every committee. So I want to just highlight and bring out the key metrics and our key areas and some slides. I just want to go through them. So I want to just highlight first in terms of slide 5, in terms of it's not slide 5, it's number 5 in terms of paper around care at home. I just want to highlight there's 2 graphs there that I want to just pick up on. The first one there is the total number of people assessed and waiting for a new package of care. There's a slight reduction there, but it's still a very high number. We're talking from a high of January of 348 down to 326 as of April. That's still a very, very high number, but I just wanted to highlight that small reduction, which I think is quite important. The lines below that are in purple and amber essentially show those that are in hospital. So those are your delayed hospital discharges that we will cover at a separate slide around DHD. So I just wanted to highlight there in terms of that highlights those are waiting care at home service, and those that are in hospital have been assessed as a care at home service, but they're currently still in hospital and we're waiting to flow them out of the system. In terms of that graph below, it includes unmet need. It's split by district. It shows a weekly comparison there between unmet need across the districts. As you can see, very little movement in terms of that unmet need. It's still a very high number. It's 2,600 hours. And despite significant organisational provider effort, that number is very hard to shift. You can see that clearly across all our trajectories that we've got for care at home. Now I want to take you on to page. I just want to go on to page 7. This essentially shows the activity areas for care at home. As you can see, very flat in terms of our in-house service and our commission service. That shows the challenges we've had flowing people out of the system. Very static in terms of our in-house service delivery and our external delivery. Just wanted to highlight there. The key thing I just wanted to follow on from Colin's paper is that our commissioning and transacting teams have worked very hard to make sure that the increased rates have gone out to our providers to enable them to pay that minimum £12 per hour that's been funded by the Scottish Government. So all that rates have been passed on to our care at home providers, and we've managed to get that enacted very quickly so they can pass on that payment to the hard-working care workers we've got delivering a care at home service. Below that, there's also 8 commissioning proposals we're working our way through, which I think will be part of a separate paper that'll come back to committee. Just following on from that, I just want to go to page 9. Page 9 is really important. I know today there's been a lot of topics on adult social care, so I won't go into the specific details for that. I really would want to pick up, though, how challenging it is in terms of the overall care placements we've got. If you look at that number that's on the top graph on the left-hand side, it's 1,687 people we have placed. If you go back and look 2 years, in March 2022, we had 758. That shows the real pressurised state we've got across our care home providers, our care home external providers, and our in-house estate. I just want to highlight there that also during that period, it's not reflected in the data yet, is that Cradle Hall Care Home closed at very short notice on the 17th of April. And it was due to regulatory actions, and NHS staff relocated 41 residents over a 3-week period. So we expect, well, I'm drawing that one out for yourself, Chair, and members, is that we expect that pressure to continue on available care home placements due to that closure at very short notice. So in terms of the next graph I want to pick up, it's the delayed hospital discharges. It's page 11. This is the North Highland one. The one that comes next includes Argyll and Bute. So I just want to focus on North Highland. It essentially shows those that are awaiting in hospital. There's 191 people as at the last data point. That's not there on the slide, but this just shows the breakdown between care homes and care at home and the people that are actually waiting in hospital split by the current area. So again, 191, a very challenging position. I think the figure today is 197. So we're not seeing the number going down. We're seeing a continuing pressure for our both acute and our community hospitals in terms of delayed hospital discharge. The slide I'd want to pick up here in terms of page 13 is just to give committee an update on the carer breaks. This has been one that's been missing for a couple of committees because of staff movement, etc. I just want to highlight that the scheme reopened again for Q4. It's really important that you'll see on the right-hand side with 141 applicants that were transitioned through that process. Of that, 125 were approved, which is excellent. So that scheme has reopened. I'm delighted to highlight there in the management update, a new carer services development officer is now in post, and we're working with our unpaid carers and working in collaboration with all the people that provide these valued carer services for us. The next one I want to highlight, which I know I've been here previously talking about in terms of option 1 direct payments, is page 14. You can see very clearly the growth that we've got in our option 1 direct payments. We know a lot of the reasons for that. Again, just want to highlight to the committee that we passed on the uplift, the fully funded uplift from the Scottish Government to our recipients of option 1. You can see there that that is a real increase in numbers. I'll be suggesting for the next report that we maybe have quarterly data points and we just have monthly data points for the in-year to make it a bit easier for people to read. It's a bit cluttered now, so just need to have a word with the people that produce this just to get that split for you. The next thing here, I just want to highlight again around option 2. This is individual service funds, where we are asking the provider to provide services on our behalf. Personal budgets works really well. Really good to highlight here in terms of that growth. We saw a dip during the pandemic, but if you look at the data point as at March 2023 and look at our data point March 2024, you can see we're back to pandemic levels, which is really good to see. So a lot of work has gone in to individual service funds. I think Ian would have referenced that in his work that he's doing around promoting choice, flexibility and control. Just to take the last key one here that I've got from adult social care, we've got our adult protection normal slide that we have, which again, if we're okay, Chair, I'll do the same thing. I'll have quarterly data points and get monthly and year for you, so it's a bit easier to read. You can see clearly there the number of referrals, the increase in referrals and the referrals from the different places below, which is the graph below. Just want to highlight there that the adult protection, the NHS Highland went through an inspection around adult protection. That output is expected to be back with committee in the coming weeks and months. I think it's expected last week. So the last one I just want to highlight here is around psychological therapies. I think the key area here is that if you look at the standard is that 90% of people commence psychological therapy-based treatment within 18 weeks of referral. If you look at the March performance, it's slightly below that, it's 88.5%. But I think you can see from the graph and you can see from the improvements that have been made in year. I know there's still some way to go, but I just want to highlight there that you can see some real improvements there. But the not so good news is the news on the slide below, which is your waiting list. There's 711 people waiting to access the services. Unfortunately, 333 patients have breached that 18-week deadline. So I just want to kind of draw that out in terms of the IPQR. So in terms of the key metrics that I want to draw out, Chair, that probably would be those. Just to go back in terms of the report and the covering report at 2.4. I mean, given the ongoing challenges with the access to social care services, delayed hospital discharges, and basically accessing services for our general population, limited assurance is offered today, and that's linked to the IPQR because of the service demands that we've got right across the whole health and social care system. That's me, Chair.
Thank you very much indeed, James. I will throw it open to colleagues for any, again, comments, observations, questions of James. There we go, Muriel. Nearly just beat me there, Muriel. You beat me.
No, apologies. Thanks, James. That's a very comprehensive report with lots of data. I think I just wonder if Chair will bear with me, but I wonder if we could maybe break this down a wee bit more, because we've got two hills. We've got Argyll and Bute, and we've got Highland, the NHS Highland Council component, and I think it would be helpful to compare and contrast, particularly when we're talking about, and also looking at our rurality impact as well. I think it's something that we talk a lot about, but I think we need to be able to reference the challenges there. And the slide that shows, I know that the HADP in both Argyll and Bute and the NHS Highland area are trying to work their socks off, but I think we need to recognise that we're in the very top in Scotland, and that is a real concern to me, and I'm sure it is a concern to everybody else. So I think this is a huge amount of data, but I'm just wondering if there's any way that we can maybe strategically look at it in more bite-sized chunks. Thank you.
Maybe if I just come in the back of Muriel there, and Pam and I have had some preliminary discussions on this. I think and this is all my personal opinion, but I think we've reached a point with the IPQR when it's maybe time for us to just have a little think. I think what we've had for the last year has been excellent. It really has. But I think James and I had used the word stable. James, you used the word static, but meaning the same thing. We've got lots of data which is more or less flatlining now for a period of time, and that's not due to inactivity. Actually, we should be positive about that, is we've managed to arrest the deterioration in the system which we had in there. But I think that I think we're at that stage now where it's time for us maybe just to have a pause and a reflection in terms of what is it we want from our IPQR at committee with reference to our terms of reference. How do we provide that assurance, and how do we get that meaning? And I think the most important thing for me is how do we get that meaningfully linked to the strategic work which we're trying to do in that transformation which we're trying to undertake. James has referenced Ian's excellent report this afternoon. So I would probably put forward that actually just seeing an absolute number is not a measure of all the work that Ian and the team are actually going on there, but how can we actually tease that out a little bit more? So I think I would 100% agree with you, Muriel, in terms of it's time. I think it's time for us just to pause and just reflect on where we are. That's not to say what we've got is we don't like. It's served its purpose, I think, and it's time for us maybe just to enhance it and move forward a little bit. And with committee's agreement, with Pam and I and Lorraine, we'll probably start to take that journey and actually see how we might actually do that. But I see there's a few hands up there. Pam, I'll come to you, and then Christopher second.
Thanks, Jane. I just wanted to reflect on the GMC discussion that we had around reporting and needing that to be much more outcome focused as we go forward. So really showing the impact that we're making, through our interventions, and reflecting on the wellbeing activities that Gillian presented earlier. So changing the focus of just continually talking about the data and the trends to making that much more meaningful in terms of our outcomes. And in terms of our waiting list data there, we're still trying to define data around validating where the data comes from and trying to make sure that it's accurate. And I'm not sure that that's helpful for committee to keep receiving iterations of data that we're still trying to improve. So definitely working in that space and working as part of our development session to agree what we need going forward as a committee would be really important. Thanks, Chair.
Christopher.
Thank you. I also thank you, James, for the report, which has a lot of data in it. The only thing is, this is a comment really, I would value a bit more clinical illustration. For example, take the referrals for psychological therapy. Do we know why they're referred, with what sort of problems? And do we have any way of measuring whether our services have benefited them? What was the outcome? I mean, there's not much point in providing these services unless there is some evidence that they're doing any good. I know your figures don't provide that, but that to me would be an extremely valuable adjunct to what the sort of information you're providing.
I think
I'm
just going to say I think you're absolutely right, Christopher. Because again, it's all about getting context and all that for these measures. Oftentimes now, just looking at it, I think just looking at a number in isolation won't tell us the full picture. So I maybe let James come in there because he's far more data savvy than I am.
No, thanks, Chair. In terms of comments that Muriel's made and that Christopher's made, I think what is lacking from this, I think Pam has highlighted this, is that I was involved in the development of this, which was very much adult social care focused 2 years ago, Chair. And I think it needs to move on from there. I think you've recognised that in terms of because the indicators are very much service activity indicators, and they're not changing on a monthly basis. For example, there's lots of information we've got around rurality, around districts, around that kind of information we can bring out. In fact, one of the things that myself and Ian are working in collaboration for is getting some more qualitative data in. So, for example, all the work we've done around our option 1 uplift, what actual difference has that made? So talking to people. So I think there's a balance here of service delivery information, but more qualitative data. And I think it's really looking across the partnership rather than just, because what we're seeing here is very much adult social care with a few other ones around community mental health teams. So I think, Chair, just what yourself and other members have said, it would be really good to kind of refresh that discussion around what it is that the committee want and need, and we could then maybe start developing that in consultation with Rhiannon, so we've got a wider spectrum of information here across North Highland adult social care and the whole partnership.
James, thank you very much. Thank you very much for that. I think from the nods I'm seeing around the virtual room, I think we're in agreement. We're in agreement there, and I know it will be a journey. We're not going to expect it to change by our meeting in July. It will be a journey, but I think what we will capture in the action log, Stephen, is actually our commitment to actually start that journey. And I think probably the beginning point is myself and Pam to meet with Lorraine and whoever she wants from her team to actually work out where it is we want to go. But what I'm very keen to do is exactly as we've just been talking about there, is tie it to our strategic intent. So how are we measuring what changes we're making, and then we can think about, are those changes making the difference that we had hoped they would? Because if they're not, is it time to think about something else? The other thing I would just like to capture for the minute, I think the drug and alcohol team progress. I think it would be remiss of us if we didn't capture the excellent work that is ongoing there in the team in terms of applying the MAT standards and actually the response time. Because exactly as Muriel says there, we are extremely challenged by our rurality in actually delivering some of the MAT standards. So for the team actually to achieve that, I think we have to take every opportunity to recognise that. So I'll draw that to a conclusion and say, are we happy to accept limited assurance from the report? I'm seeing thumbs up, and thank you very much, and thank you very much indeed for your time, James.
Thank you, Chair. Thank you, members.
Okay, we'll move on to Pam and the Chief Officer's report. Pam.
Thank you, Chair. So a few issues to highlight to bring to your attention from my Chief Officer report. The first one is the joint inspection, adult support and protection for Highland Health and Social Care Partnership area. We've had a feedback report about that. So the inspection has concluded, and we're getting some feedback on the findings, and there's a number of a couple of sessions that are being delivered. That feedback is currently live. I'm not sure of the status if we actually, if it's been agreed yet by the multi-agency partners. So, we'll be bringing that back to committee for a more detailed update. And I wondered if, Ruth, do you want to just come in there and give us a status of the report? Because I know that at the time of writing this report, it wasn't quite in the public domain. Thank you, Ruth.
Certainly, Pam. So yeah, just to say that the thematic inspection is now live on the Care Inspectorate website for anybody to access, and obviously is for health, social work, social care, but also police as well. And note there on your report, Pam, the sessions that Ian will be delivering are for the whole partnership to hear the feedback around that. We have got areas of improvement, as we'd find with any inspection, but the inspectorate were keen to say that that was part of any expected improvement cycle, and overall was a positive inspection. And we'll obviously, as you say, Pam, we can break down the areas of improvement and come back here with more detail. So it's available for anyone who wants to see it.
Thank you, Ruth. Okay, Cradle Care Home we've already discussed in the meeting. Vaccinations, I just wanted to remind everyone that we are working through our performance with the Scottish Government and with Public Health Scotland in terms of the strategies that we have to improve to improve our citizens' experience and access to vaccinations. We've got some areas of work that we've been looking at, particularly around childhood vaccination and robust pathways for post-exposure prophylactic vaccinations, which a term that we'll be familiar with to help understand that would be like for accessing a tetanus vaccine, for example. So we're getting good support from Public Health Scotland as well as a critical friend, just to look at our processes, and we're working with the national team just to make sure that the booking system is good and accessible and easy for people to navigate, and that they get their appointments as close to home as possible, and that we don't end up with some of the complexities that we've had in the past. We are currently looking at the delivery model and in line with our overall strategy, wanting to deliver that closer to home. So we are developing our options appraisal for alignment within our districts, and we are taking wide stakeholder engagement with that from mid-May. So people around the table will be engaged in that in various different forms. A really positive piece of work and innovation is the DadPad app that's been launched by NHS Highland by the perinatal and infant mental health team. So the app's available across Highland and Argyll and Bute, and it provides dads with guidance on how to support and seek help when they become a parent. And that's something new and innovative, and we'll be looking to see how that is received and the outputs from that going forward. So a nice new innovative piece of work. The Community Link Worker Service, I've provided an update just in terms of the short the history of the service, but the numbers of referrals to the service to the end of February 2024 was 1,782, and the main reasons people accessing around mental health, loneliness and social isolation, financial issues, bereavement, stress, housing and essential needs. So if we think about our data, and how people access secondary care services around psychological therapies, developing upstream interventions and upstream models is really, really important. So we're using a validated wellbeing score tool to measure people's outcomes. So again, we want to do more work around outcomes as we develop our iterative annual performance reports and implement our joint strategic plan. The new contract for the Community Link Worker Service will run from the 5th of July for 3 years and has been awarded to Change Mental Health, who are the current provider. So a good thorough reprovisioning exercise and good sustainability within the service, and we're doing a bit of research as well. So more positivity around outcome focused data that we're able to present to the committee. The feedback from the Joint Monitoring Committee, we outlined the future strategic reporting to the Joint Monitoring Committee. So Fiona Duncan and I did a joint report around that. Ian also presented the Integrated Children's Services annual report that we saw today. In terms of the Adult Services Update report, we talked about some of our data and our trends and our outcomes for people, and the framework around how we were responding to some of those. And we had the NHS Highland and Council finance reports. So again, that frame, very heavily came through at the GMC just around the outcomes data, the impact on our citizens, either around waits or delays, and what we're actually going to be doing about them, and using the appropriate metrics to demonstrate improvement in how we're going to actually reduce people waiting and delay, for example. Enhanced services, we are currently in very fast-paced negotiation with the LMC. I haven't put the detail into this update because we are at quite a detailed stage of agreeing 5 specifications at the moment. So we are hoping to be taking them forward at pace and to stabilise and implement new enhanced service contracts going forward. So that's really all I can say about that. We did have a joint communication from the last meeting, which was held earlier on this week on Tuesday, and we held a meeting last week where we put out joint comms to say that we were reaching agreed positions and that our negotiations were more positive than they had been hitherto. So that feels really good. Number 9 is a duplicated paragraph. So I'm sorry about that. And just in terms of the Joint Monetary Committee, then Councillor Fraser has reached the end of his tenure as chair of the GMC for the period, and Sarah Compton-Bishop, the NHS Highland Board chair, will take up the chair from 12 months from the 1st of April. So we'll meet again in May at the GMC. So that's all I was going to say about my Chief Officer update. Thank you.
Thank you very much, Pam. I'll throw it open to questions. I've got a one in my head, but maybe somebody else will get there first. Philip.
Thanks, Jerry, and thanks, Pam, for the report. I was wanting to just have perhaps a bit more explanation about the vaccination programme. It's concerning that we're getting escalated to that level, and I just wonder. I note in the paper that there will be options available for further consultation by the middle of May. Are you able to give us any early indication of what those options may be and any favoured option that you have? And also with respect to delivering the winter programme, just what level of confidence we have that we'll change our processes in time for that to deliver a successful winter programme? Thanks.
So in terms of the escalation, that's intended to be a supportive experience to bring the Scottish Government and Public Health Scotland alongside to help us learn from other models across Scotland, which has been really insightful, and to also help us develop some of our trajectories to enable us to demonstrate where we are making improvements and where we need to look at our delivery of the programme and the interventions that we need to do to improve. So we've got focused fortnightly meetings with the government where they set the agenda around a subject area. So at the last meeting we were looking at childhood vaccinations, at the one before post-exposure prophylaxis. So we're working through each of the delivery settings and programmes, and we're looking at how we can improve. Along with that, we are, as I mentioned, doing the options appraisal. What we're trying to do is essentially align the vaccination to local delivery, so that we've got much more local delivery and more oversight locally rather than a centralised programme. We recognise that with the National Booking Service, some people had been booked to areas that were out with their own geographical area, travelling many miles for vaccinations, and also the staff experience of a centralised team travelling maybe 4 hours to deliver childhood vaccinations and maybe only undertaking 2 or 3 vaccinations at a remote clinic. So from a quality and safety perspective, then making sure that we deliver more locally where there's more staff around, where we can work across a multidisciplinary team, and that we can maximise the resources that we have for the delivery. So the options appraisal is around identifying where we're actually delivering the model well, where we've got good uptake, where that's a good quality service, and that we can move to implement that really quickly. Where we might not be able to deliver services or accessible services for vaccines due to workforce or due to the distance that people have to travel, then perhaps we may have to look at variation orders. So, you know, that's part of the consultation. So there's a whole stakeholder engagement needed to look at all of those options. So that's what we're hoping to outline and have ready for engagement on the options by the middle of May, by articulating where we can do it well, where we can align it quickly, where we can do that for good quality, but where we need to have wider thinking and engagement around future sustainability. Okay, thanks, Philip.
Joanne.
Thanks, Jenny. Just coming in on the back of that, Pam. Will communication to the wider public be part of the help and assistance that you're getting? Because
Yes.
there's, you know, some people out in the community that probably need assurance again of the importance of vaccinations, as well as the booking system and the route to securing vaccinations. So will that be covered under that? And also, are we the only board nationally on special measures, or is there anybody else the same? Thank you.
I don't know if there's other boards on special measures around the vaccination programme, but you know, we are working hard to improve the experience of vaccinations for people. We've done a lot of data analysis around you know, journeys from home to clinics and how close people can access vaccinations. We've done a lot of quality improvement work with the National Booking Service to make sure that when people phone up, they're not booked to a clinic because perhaps the person making the booking maybe isn't affiliated with the geography of the Highlands. We're hoping to take some of that in-house. So we definitely want to do much more engagement, and there was quite a lot of feedback that we received around last year's autumn and winter programme. We've done a lot of learning, so you know, changing our systems and you know, hearing from people's experience has helped us focus in and provide assurance to the government that we've heard from the population around their experience of booking and travelling to clinics and how we want to improve that going forward. And essentially that has been the baseline really for us wanting to take that closer to home and into the districts. And we'll definitely be engaging far and wide. We've been doing a lot of sector work around you know, where we actually deliver vaccines, so making sure that we've got accessible venues and that people's experience at those venues is positive as well. So there's lots of different aspects to where we'll be looking with our sector partners, not just in terms of the vaccine team delivering the vaccines, but also the experience and engagement across the sector around accessibility. Thank you.
Thank you, Pam. I think given the importance of the vaccination programme in general, but enhanced by the fact that we've been escalated to Scottish Government, I think we should leave the vaccination programme on the agenda for certainly our July and September. And apologies if I've got those two meeting months wrong, Stephen. But actually, maybe because I would expect probably by 10th of July will be a good leeway, if not completed the consultation engagement process, Pam, so we'll be able to get some feedback in that and actually have a more robust understanding of what actually the deliverables are going to be, and by that are going to look like in the timeline we've got to do that. So maybe if we put onto the agenda, Stephen, for July and September, I think an update on vaccination, and it'll depend on exactly where we are in the process in terms of what that will be. Anyone else with any comments or observations?
I just wanted to just add in there that, you know, Tim Allinson is the Director of Public Health as the Executive Lead, so around that public health messaging, which is really important in terms of the public uptake and delivering our campaign, is really important. So I think both of us around producing a paper, you know, with the different elements to make sure that we're inclusive of our whole approach to population health and vaccination delivery.
Absolutely, Pam. Absolutely, Pam. Yep. Diane.
Thank you, Pam. Can I make a request for an update outside of this meeting to you, please, in my role as the independent public and patient representative on the committee? I understand that there have been further meetings between Fiona Davis and Sarah Compton Bishop with the residents of North Skye in relation to their serious concerns about service delivery in that area, which are not only about urgent care but also about staffing levels and provision of care at home farm. So could I please ask that somebody gets in touch with me to discuss that further? Because I believe that it is an important issue in relation to how we handle community engagement and relationships in difficult and challenging times, which we are about to face on other issues. So if you could arrange for somebody to contact me about that, I would be grateful. Thank you.
I'll do that directly, Diane, and I was over in Skye just the week before last around the urgent care issues, and I joined Fiona and Sarah for part of their visits. So I'll engage with you directly.
Thank you very much.
I'm happy to do that.
Thank you for that, Diane. Okay, I would just like to pause and just say how much I welcome the extension of the community link workers to all the GP practices. I think that is an excellent enhancement to the service, and I look forward over the coming years to actually hearing what the benefits of community link workers have brought to the system, because I think it just ties in so much with what we've been talking about this afternoon. Okay, so we will move on. We've already covered blueprint for good governance, so we will move on to any other competent business. I've got one item for us all. Anybody else got anything else they would like to raise? Nope, I'm not seeing hands. But my one item is Michelle Stevenson, who's with us today, and Wendy Smith are coming to the end of their tenure as I can never remember which way round it is. Apologies, Michelle. As Wendy's definitely our carers lay member, and Michelle's another independent lay member. They've come to they are coming to. They are not there yet. They're at the end of June. Before that, but this will be their last meeting, and I would just like to formally capture in the minutes, Stephen, our utmost thanks to Michelle and Wendy for all the contributions they've made over their time on the committee. I think it is important to get those views into the committee. I know you don't always get the answer that you would like to receive, and that's absolutely the way of things. But really, I just wanted to place on the record my formal thanks. We have advertised for replacements, and hopefully that process, I don't know when the closing date is, Stephen. People have had to put up with me again on Facebook talking to them, which is never a pretty sight. So they've hopefully that will work its way through the system. But I think just my thanks to Michelle and Wendy, and thank you very much indeed. I know you've got a few weeks to go, so we can maybe just engage with each other if you've got any other issues you'd just like to bring to my attention before the end of June. But thank you very much.
Thanks, Jerry. Yeah, it's been very entertaining, and I'll probably still pop in as a member of the public now and again.
And you'll be more than welcome, Michelle. You will be more than welcome. The more the merrier is what I say. We'll have a good discussion. So with that, we will bring our meeting today to a close. Look at that. We did it in 12 minutes to spare. We did it with 12 minutes to spare. So thank you very much, everyone. And I will see you again on the 10th of July, if not before, and enjoy the rest of your day. Thank you very much indeed. Bye-bye.
Thanks all.
Thank you. Thanks all. Bye-bye.